Welcome back to KETK's East Texas Live. Joining us now in the living room is Dr. Lisk from CHRISTUS Trinity Clinic Neurological Institute.
And today he's going to talk to us about Parkinson's disease. Good morning, sir.
Hi, good morning.
So first off, let's just talk about what is Parkinson's disease exactly?
So Parkinson's disease is a disease of the neurological system of the brain. And what it does is that it accelerates the death of neurons that produce dopamine. And this chemical called dopamine is important to help us with our movement and coordination.
Okay.
Now, April is Parkinson's Awareness Month. Why is it important for you guys at CHRISTUS Trinity Mother Francis to raise awareness to this issue?
Well, it's important, first of all, this is the 200th year anniversary of the discovery of Parkinson's disease.
Oh, wow.
1817, James Parkinson wrote an essay on the shaking palsy, where he described people walking by his office, and he examined 3 patients that had Parkinson's disease. So this is an important year, and also it's important to bring awareness so people, first of all, know what they have, and that they know that you can have different types of Parkinson's syndromes. There's not just one type of Parkinson's syndrome. And also, research is the only way we're going to have a cure.
So how common is this, and really who is at risk?
People usually over age of 65 are at risk. People sometimes wonder, if I have a family history of Parkinson's disease, am I at risk? Well, only 10% is genetic. So it's mainly sporadic. It happens without a genetic link that we know so far. It's also, the people that are at risk are people that are exposed to pesticides, organic solvents, and also herbicides, because that increases the risk of Parkinson's disease. So it's like your genes are the gun and the environment's the trigger.
Oh, wow.
So what are the symptoms of Parkinson's disease? At what point should you go get tested?
As soon as you feel that you have a tremor, you have slow movement, and don't blame it on grandpa, grandma, getting older, old age. You know, if you're moving slow, if you feel stiff and rigid, you're having postural and balance problems, then you should see a neurologist, and specifically a movement disorder specialist, which is someone who does extra training after neurology residency, specifically in movement disorders.
Well, and you were talking with us during the break, and we were both really surprised. You were saying acting out in your dreams or while you're sleeping is also a sign then. Kind of explain that.
There are symptoms that can occur before you have your first physical sign. Your first tremor, before you have any physical signs, you can have something called REM Sleep behavior disorder. Now, we've all heard of REM sleep. Normally, your brain paralyzes your body when you're dreaming. This is the inability of your brain to paralyze your body during dreams. And so people will get either one of 3 Parkinson's syndromes. Parkinson's disease, Lewy body dementia, which Robin Williams had, or multiple system atrophy, which is another Parkinson's syndrome. It's a mimicker. It looks like that. So 60 to 80% of those people will develop Parkinson's disease or Parkinson's syndrome. Also, decreased sense of smell. That increases your risk from 50 to 70%. And also constipation as well.
A lot of good information. Thank you so much.
Thank you very much. Well, coming up, more clouds and more humidity.
Marcus has a cooler forecast.